To start by thanking Senator and Chair of the Judiciary Committee, Dick Durbin, and his phenomenal staff for your leadership and this opportunity. I would like to thank and great ranking member Senator Chuck Grassley and the other members of this important committee. My name is Rony Pontieux. I'm a Haitian immigrant, a worker with temporary protected status, a registered nurse and essential worker during COVID-19. I'm also a member of Family Action Network Movement, FAM. I would like to thank the Almighty for protecting me during the pandemic period. I would also like to send some words of comfort to those who lost their loved ones, a family member or friend. I work at Jackson Memorial Hospital COVID-19 Battleground, where I save lives every day. I've been here for 22 years now, since 1999. And since 2006, I've been a nurse. I'm currently working for Jackson Memorial Hospital in a unit specialized for COVID-19. I put my life in danger and on the line to save American lives. Every day, I'm exposed to COVID-19 in order to save other people's lives. Many TPS holders are healthcare providers. I'm one of them. I put my life on the line every day to save American lives. And I'm asking the US government to permit me to remain here with permanent residency. I came to the US 22 years ago with my wife, Marjorie Pontieux, and we have established our lives here. I was granted temporary protected status, TPS, by immigration officials when the earthquake left Haiti in shambles a decade ago. My wife and I have had 2 US-born children, Christopher Pontieux and Ronid Christina Pontieux. We put ourselves through nursing school and bought a house in Miami-Dade. My son Christopher is an E4 specialist in the US Army. Christina is a young leader at FAM. She's the co-chair of CFAR, Children for Family Reunification. My family risked their lives for this country. We have served this country and feel that we are Americans, but our immigration status has remained temporary. Given the contribution of TPS holders to this country, I respectfully urge the US Senate to support the Dream and Promise Act that includes a pathway to permanency for immigrant youth and temporary protected status holders. Permanent status will allow TPS recipients to be more productive, continue paying more taxes. 30% of TPS holders are homeowners who add to our local economies through sales and property taxes. TPS holders play an active role in our children's lives. We attend the school meetings, recitals, and sports games. As of 2017, 273,000 children have parents with TPS status. Over 50,000 of these children live in Florida. If permanency is not granted, our children would face serious risk. These children would be forced to face separation from their parents or be forced to relocate to a country that is foreign to them. It would be extremely difficult for me and my family if I were to be forced to leave after 20 years of living in the United States and return to a country in shambles. Not only am I thinking daily about saving lives and taking care of my family, but in addition to that, I have to think about the possibility of leaving the United States eventually if I am not granted permanent status. We believe in your compassion. We believe in your understanding. We believe in your good judgment. And more importantly, we believe in your leadership. We believe you will make the Dream and Promise Act a reality. More than 300,000 TPS holders are waiting. More than 270,000 US-born children are waiting. Let's work together, Democrats and Republicans, to have immigration reform that will change the lives of millions. TPS recipients will keep their ends of the bargain by working hard, paying taxes, contributing to build the social, economic, and political fabric of this great nation. May God bless you. May God bless America. Thank you very much.
Thank you very much, Mr.
Year-old son is in the Army. Your daughter is a middle school honors student. How has living with this constant uncertainty affected your family and maybe prevented you from making investments that you would normally have made?
Thank you, Senator, and thank you for the question. And I would like to say that after I finish my registered nurse license, I plan to go to the university to pursue a career to become a nurse practitioner. But because of this uncertainty, that's mean the possibility of being deported, that's hold me. I could not go further. I even went to the hospital because of high blood pressure, and I'm on medication at this time. Even I'm saving lives, I'm taking care of patients, but also I have to take care of myself because now I have high blood pressure. So with if you vote yes for this bill, I already registered to go to the university to pursue this career, to go for a nurse practitioner. I would like to become a nurse practitioner to serve this country because I feel that this is my calling. Even sometimes nurses are calling sick because they are afraid of the COVID. I'm always there, and I pray God to help me, not only to give the medication to take care of the patient, but to save their lives.
Thank
so
you.
now I will be able with this bill continue to go to school for a higher education and be able to take care of my family. Thank you.
Oh, so beautifully said. So beautifully said. I want to thank you, and also you, Mr. Mayor. I'll send to do a question on the record, but thank you both for being here and all of the witnesses. Thank you.
Staffing shortages at the hospital where you serve, and what impact it might have if we were to provide some certainty and a path forward for medical professionals like nurses.
Yes, like I said earlier, as a healthcare provider, I've been facing death every day because of the COVID-19. And every day I go to work and I think that I have a responsibility to take care of patients to save lives. And it is my goal to save as many as possible. And with my temporary status, I always think that I'm limited, I cannot go further. But now, if the Senate want to vote to give their yes, I will be able not only to continue to work to help more patients, to save more lives, but I will be able to continue to pay taxes and to take care of my family. And this is what we want. We only want a chance. In 2006, I've been given a chance to go to school. I have financial aid, and I went to Sheridan Technical Center where I get my practical nurse license. And since then, I was able to work. And after that, when I went to college, I was able to pay the tuition from my pocket because the school didn't have financial aid. So the same way I want the Senate to give those 200,000 people a chance to have a higher education and to continue to work to take care of their family and to stay in the United States.
Thank you. Thank you both for your testimony. And
Thank you, Senator, for the question. I appreciate that. And this is the situation. I've been here for 22 years, and I've built a life here. I have 2 US-born children that never know Haiti. My daughter is with me. She's always with me, coming to Washington, D.C., and she never know Haiti. And you know the situation in Haiti, the country is in shambles. and there's no way I can go back to Haiti with my kids to have a life. So in order for me to be here for them, like my daughter wants to become a lawyer, so she will need me to help her, to guide her, because if I go back to Haiti, it's going to be a disaster. So with the renewal of the TPS, that helped me to take care of my children, to take care of myself, my children, my family, and to continue to serve the community, to work as a nurse, as a healthcare provider to save lives.
And clearly, this 18-month extension is critical to you and your family. For Mr. Rodriguez,
actual topic of today's hearing. When the Deferred Action for Childhood Arrivals, or the DACA program, was first announced by President Obama 9 years ago today, he said that the program was not a path to citizenship or a permanent fix. It was a temporary stopgap, but would provide some relief and hope to talented young people while Congress would work on the permanent fix. DACA was rescinded by President Trump in 2017 and has been litigated in the courts for years. So far, has been largely upheld by the federal courts. Those are the facts. So my first question is